place in health professions, education, and beyond. I'm Nicholas Torres. I'm the Executive Director of the Network Towards Unity for Health, and honored to be here present with you today. As many of you know, the TUFH Symposiums is really a series that we're doing in addition to our conference, TUFH 2021. If you haven't registered, we hope that you will join us. And this is a way for you to share your knowledge, and we can learn with and from each other. Today, I am happy to introduce Professor Thomas Chayko, and he was awarded the International Fellowship of Medical Education in 2002 when he completed with distinction at the Department of Medical Education in UIC Chicago. He was also a 2-year Educational Leadership Fellow from the Famer Institute. I will not go into too many details about him, and as he can introduce himself. Upon completion of his presentation, we will invite you for a brief session of questions and answers, and then per TUFH, we want to learn with you and from you, and so we will have breakout groups. And in those breakout groups, we will provide you with some guiding questions where you can elaborate upon what you learned today and then share it back with the whole group. With that, I introduce you to Professor Thomas Chayko. Please take it away.
Thank you, Nick. It's always a pleasure connecting with TUFH network members. And I chose this topic because in the current scenario of COVID, blended learning has caught up. And I just want to highlight some of the things that we need to keep in mind to get the design of the blended learning at an optimal level. So the context of the why this presentation, and then how blended learning meets those changing paradigms, and then need to factor in the learner maturity and degree of self-direction amongst the undergraduate, postgraduate, and after qualifications. I have used the Indian model of learner maturity. This learner maturity could be different in different settings. Then matching the blended learning in the above stages of learner self-direction, and my experience sharing of implementing blended learning, some pointers to make it a success. And as Nick suggested at the end of the presentation and your breakout rooms, during breakout rooms, you'll reflect on the learning and provide feedback to the network about this symposium. This picture is to highlight that we are dealing with a new generation of learners, and we need to be cognizant of that and their learning styles. Most of us teachers were born in the old school, and now we are dealing with learners in the new school, and so we have to be aware of that. And the current generation is born in the digital age, and so we have to be aware of that, and we need to design our blended learning accordingly. It is interesting to note that the generation Z, as we call the new generation, born in the post-millennium, they hardly listen to lectures, and most of the learning is by seeing, 38%, but the majority of them, they learn by doing and working through examples. So accordingly, we have to keep that in mind when we design the blended learning. As facilitators of learning of our students, we are producing the learners for the 21st century. And so they need to be equipped with 21st century skills, which are collaborative learning, critical thinking, communication via the digital mode, creativity, idea generation, openness, work creativity, and creative production and innovation. So we have to also design a blended learning um, in such a way that these things also get encouraged. So have a look at a comparison of old school versus new school. We are all familiar with the old school, time-based, whereas 21st century it is outcome-based. And we have moved on from textbook-driven to research-driven, from passive learning to active learning, from teacher-centered to student-centered, and from print to multimedia, because they are all visual learners, from isolated learning to collaboration, and from facts and memorization to higher order thinking. Um, there are changes in the 21st century learning spaces also. And so we have to be aware of that and also aware of the assumptions. Learning only takes place in classrooms is the old assumption. New assumption is learning happens everywhere. And so blended learning fits in. Learning happens at fixed times, and in the new assumption, it is learning happens anytime. And learning is an individual activity, and the new assumption and paradigm is learning is very much influenced by the environment. And then uh, moves from one teacher per class to collaborative teams and team teaching, because it recognizes that different teachers and different abilities of the facilitators must complement to meet the learning needs. And moving from separate single classrooms to multiple reconfigurable and linked learning spaces with technology. So this shows the type of learning and the changing styles from pedagogy to andragogy to synergogy, cybergogy, and finally self-directed learning. So earlier it was teacher-centered, teacher dictating the knowledge, and then it shifted to self-directed, and then to self-determined, where the learner chooses. And in the new paradigm, the new normal, we have uh, to shift from distance learning to um, mainstreaming of the um, blended learning. So what exactly is blended learning? Most of us are familiar. It's the blending of e-learning with classroom learning, uh, which is connected, online learning. Uh, at the same time, it is it has elements of face-to-face and project-based learning, and it also caters to the need of the individual learner, and there is a scope for online learning and learning in small groups for collaboration and collaborative learning. So blended learning is a match for the new paradigm of learning. Um, Next, we are going to understand how learning takes place during undergraduate, postgraduate, and after qualification as a health professional. This article of mine was shared by to all who had registered, and it uh, shows the learner immaturity in the beginning, and that is why teacher control is happening. And in the teaching of basic sciences, this is what happens in the initial years and early clinical phase also. And then there is a shift from pedagogy to andragogy, where there is building of prior knowledge gain in the earlier stage, um, and to application of knowledge. And during the postgraduate training, there is a combination of andragogy and heutagogy, where it becomes mostly learner-centered, self-directed, with teacher as the facilitator. And the role of the teacher is providing experiential learning, or we call it single loop experiential learning. And then to professional practice, when you are qualified, then once you are qualified, you are busy with your practice, and you determine what you need to learn further. And so there is a further skill building and double loop reflection in practice, in your own practice, to identify further learning needs. So that's how it goes over the years of health profession education. And now, how do we match blended learning methods in the above context? Because sometimes we become carried away with blended learning without recognizing um, the level of learner maturity and self-determination across different phases of health professional education. And so we need to match according to the learner um, degree of maturity and readiness for self-directed and self-determined learning. And so in the earlier undergraduate period, it is teacher-centered, the typical classroom, case-based learning, assignments are there, problem-based learning. These are the methods we are familiar with. And then during the postgraduate period, either in the hospital or in the community, and there we receive feedback and simulation lab. And then during the postgraduate means during professional life, we it is mostly self-determined, where we listen to podcasts by experts to update our knowledge, um, and then we engage in CPD workshop series because it's skill rather than just knowledge improvement, and mostly blended learning takes place at that time because of the convenience that it provides to the professional, because they are in the normal timings, they are quite busy with their own practice. And so methods that are commonly available are mobile learning and various web and social media enabled learning, collaborative learning in communities of practice. Then there are options for fellowship programs and distance learning programs, which are chosen by the healthcare professional. And further development of skills to high fidelity simulation labs and practice and feedback on their learning. Uh, so, how do we implement this blended learning? Some of the pointers, uh, and one of them is to remember, for the acquisition of skill, there is skill is based on the cognitive foundation, and we need to move and take the student from knows to knows how to shows how and does. And so development of competence, the cognitive component, that lays the foundation, and based on that foundation we have to then build during the clinical period and professional life, where performance uh, needs to be built on prior knowledge and use of various um, educational strategies. Uh, because now we are mostly in the COVID paradigm where the students are learning from home, then even in normal lectures there is a challenge to engage the student, and so in the virtual mode even it is much more challenging. And so in the lower cognitive domain, we have to use asynchronous lectures or sessions which engage this. The focus is on engaging them, and there are certain ways where we can engage the learner, and the learner can interact with the learning material while they are self-directing. And it is up to us teachers to give them assignments that will get them to think through various mechanisms, and their output from the self-reading indicates to us whether they have understood or what is it that they have not understood, and then we can supplement their learning or learning gaps through additional information and YouTubes that fill in the gap. And so we are also familiar with the flipped classroom model, where outside the class time is mostly the lower cognitive domain stuff that the student learns by themselves. And in class time, the presence of the facilitators is meaningfully used for application and analysis of knowledge, so that they get higher and more efficient um, output of application of knowledge in the presence and guidance of the teacher. So, in an engaged learning model, uh, constructivist principles with problem is important, and that results in engaged learner. And what I had described earlier with the flipped classroom, we can have a virtual flipped classroom scenario, and their assignment output will indicate their learning and the gaps in knowledge. Um, Most of the teaching learning during the undergraduate period is through the learning management system, and that system needs to be set up. And what is important is to have the support of online socialization through whatever means that is possible, that is popular locally, and important messages that need to be transmitted, and the relevance of learning to their future job and profession is what is introduced at this point of time. Then that charges them up for self-reading. They are motivated and identify after self-readings, further learning needs are identified, and then the assignments um, helps in understanding and facilitated learning. And another set of assignment where application of the learning that was developed through self reading happens, and that feedback on performance and grading provides them um, the development of knowledge base. During clinical years, we have to take them from knows how to shows how, and provide opportunities for them to do and then test their performance. And for that, even in the virtual or a blended learning situation, we could initiate the learning by showing them the real thing, watch YouTube videos, do role play, and they observe. These are the sharing of experiences. The learners are then encouraged to perform and record their own. Now everybody has cell phones, and they can record and share the recording of their performance initial stage. Then they are asked to reflect on their experience, and they use self-assessment of checklists. The checklists are the ones that are developed by the teachers, and they reflect on what went well and what are the areas for further improvement. And that further improvement is prompted through an encouragement to do deliberate practice to act on those areas where there is scope for further improvement. And then uh, they record their final performance, and we provide feedback on the video recording. So that's the um, what was blended learning at the UG level. And in the postgraduate level, most of the blended learning that was described for undergraduate is continued, and mm, uh, we move on to post qualification professional development. As mentioned earlier, this is through CPD, continuing professional development, where the professionals determine what are the areas that they need to improve, upgrade their skill while working. So it happens in service, at work, and self-appraisal, and they act on it. Uh, all based on the action will include their options for blended learning, and the additional thing is it's self-determined, and they can learn in their own time and convenience. And it is good to become part of uh, network or communities of practice. So professional learning community, they learn from each other, supplemented by asynchronous learning through videos and synchronous learning. And the communities of practice encourage as well as peer learning happens, the learning from fellow specialists, and uh, it encourages them to move forward. So, to summarize, blended learning provides the scaffolding of the learning throughout the undergraduate, postgraduate, and the professional phases. The advantage is it allows them to learn at their own time, any time that is convenient for them, own pace, uh, because it provides them the leeway and the opportunity to learn and catch up at their own pace, own place of convenience and own strategy of whatever works for them. So during undergraduate, predominantly pedagogy, teacher-centered and teacher-controlled self-directed learning. During postgraduate period, it is mostly adult learning, learner-controlled, self-directed. The control is on the learner. And then during professional practice, it is self-determined continuing professional development. And using this experience, I could write an invited editorial on the same topic. And this is available, what I have spoken thus far is available for you to read. Over to Nick.
Great. Well, thank you very much. Very informative. We'll start off with a question from Nicholas Handoyo from Indonesia. He says, I've read your very interesting paper. I'm interested in one of the statements that there is an understanding learning theories can help teacher to diagnose learners' problems. Would you please explain further with some examples?
Your voice was breaking. Can you repeat, please?
Yes. Can you, the statement that there is understanding learning theories can help teacher to diagnose a learner's problem. Would you please explain further with some examples?
Okay. So understanding the learner, um, uh, in which phase the learner is, and whether of self-direction the learner is. If the learner is undergoing, say, for example, basic sciences in our part of the world is taught in the first year professional, and there mostly the learners have no prior exposure or experience, and so it is mostly the curriculum is delivered by the teacher, so it is teacher centered. And um, when we are using the blended learning, and we want them to indulge in self-directed learning, we provide them an opportunity to learn by themselves. But when they present an assignment, it becomes clear what is the gap in the learning. Further learning needs are developed. The way we try it is to ask them to identify their muddy points that they could not follow, and then we elaborate on the muddy points and build on it further.
Thank you. Are there other questions? You can put them in the chat box, or you can also raise your hand. While we're waiting for additional questions, we have different task groups. One is from remote and rural migrants and refugees. And one thing they always struggle with is how can you take this model learning, but apply it to remote and rural settings? that you may not be able to apply to an urban setting, or for in case of migrants or refugees, which might be in certain places that do not always allow this. How do you go from the classroom to the lab field to the communities? Can you maybe elaborate how this might be applied differently in those settings?
Okay. I had an opportunity to consult to train the primary care workers in a small neighboring country, and they they had healthcare provided through primary health centers, and mostly they were basic health workers, and there was a need felt for skills upgradation. And because there were only one or two in these centers, it was difficult to get them together for in-service training at a centralized center. So, so one of the ways in which we can use the blended learning approach is to identify the further learning needs by identifying um, um, what are the complaints from the patients, or whatever feedback is received from the patients. That helps us identify the gap in the skill sets. And once we know the gaps in the skill sets, we can design tailor-made modules, which includes a set of checklists, uh, which which explains criteria, which define the various deconstructed steps within the checklist, and that this the worker in the remote area goes through the checklist after a patient encounter, and then becomes aware about and reflects on it, so that they become aware about what they did do right, and what are their strengths, and what are the areas that need further improvement, and that those areas for further improvement, they will do deliberate practice and send a video of complete patient encounter, and that will be looked at by the expert, and feedback given to them so that they can uh, improve their competence and performance without their work being disrupted.
Thank you. And we have one last question before we go into the breakout groups. And it's from Dr. Rashmi from Manipal. And she wants to know what are the primary challenges in implementing blended learning?
Yep. Blended learning, several challenges are there. One is what we found was the bandwidth, and um, most of the students had gone without, they had gone suddenly um, during the lockdown, and they didn't even take the books with them. They thought maybe it will get over within a short period of time. It was kind of vacation for them, but then they realized it is difficult, and then what they had in hand was only the handheld mobile phones. And so we had to overcome this handicap by providing them with resource material that did not prove a challenge to internal access. So short videos, and other YouTube resources, which was possible to communicate to them, and having asynchronous sessions made it possible for them to catch up when the internet strength returned. So these were some of the ways in which we could overcome the challenges.
Thank you very much. Now we're going to share the screen and show you what the breakout guiding questions are. And so we will break you into groups of about 5 or 7. You'll have about 10 minutes. Please, 10 minutes to have these discussions, and then you will be able to report back. So in the report back, please identify one person within your group that can serve as your speaker. But the 3 questions we want you to discuss in your groups is, number 1 is think of situations during undergraduate, graduate, CME, or CPD post-qualification where blended learning worked well for you. We want to learn from you and share your experiences. Number 2, what contributed the most to its success from anything that was highlighted during symposium, anything else than this? And then the 3rd question is, going forward, what are your take-home learnings from this session that you will start putting into practice? So with that, we will circle in, but and we just put the questions in the chat box. So please go into your breakout sessions and we'll call you back in about 10 minutes. Well, welcome back, everyone. We know those sessions are shorter, and just when we're diving into it, they start interesting, but we want to make sure we had enough time to share between the groups. And so we'll have the groups report back. We have 4 groups. We're going to kick off with group 1, which Ronald Ulum will do a summary of the key points and discussion points, and then we'll move to the next group. So Ronald.
Okay, thank you very much. Ronald Ulum is my name, a medical student from Makerere University in Uganda. About the experiences that our group members shared, we found that about learning, the method of learning in some countries, they were blended, whereas in other countries were completely virtual. And we also had other people sharing experiences of having completely virtual, then later coming back to completely traditional. And from where I come from in Uganda, we used blended learning. We're having tutorials and off-ward sessions in the morning and the afternoons, then going to ward for face-to-face learning during daytime. So some of the experiences that I learned about the advantages of these for those who had blended learning was that it was time saving and resource saving in terms of having to move to some of these places to give face-to-face learning. And from experience from my career as well, that worked so well, time saving, as so many lecturers and seniors would be in one place at the same time to deliver a training. Then mainly what was shared during our discussion was the pitfalls. One of our members said that students' interests were so varying, especially when it came to the online part of the blended learning. Some would just log in for the sake of logging in, and I concur with that as well. Then network issues definitely still affected the online part of the blended learning, both in many countries and including in Uganda as well. Also, one of our members talked of regulatory pitfalls, saying that blended learning at some points couldn't meet the maximum, the minimum required level of training. And also, one of our members says that they are facing a number of challenges, including the people knowing how to use this technology, and also how to do other things like simulating placements for students who are supposed to undergo placements, especially for experiential learning. And that was a bit tough, especially during this COVID time. I think that's where one of our members is still giving way forward. I think probably they can continue from here.
Thank you, Ronald. We'll now move to group 2, which was Abdillah, Dr. Safa A. Jambi, Dr. Hotsna, Omar Edwards, Sineki Ephraim, Sylvan, and Thea. Who would like to report back?
Okay, I'll report back for them. This is Safa, and I'm joining from Saudi Arabia. I'm an assistant professor of orthodontics, and there were some other people on the team in dentistry, and we also had students as well. We had 3 people share their experiences. One of them was a student, and the other 2 were like teachers, if you like. So the idea was that the blended learning took the what it looked like was there were some online learning, and then there was their stuff clinic. And lots of people found it helpful because it saved time and it was less stressful. This was from the student's point of view. And also, there was an emphasis on that this wasn't a really planned blended learning, but it was in response to the pandemic. It was something that we've done really quickly in response to the pandemic. There were lectures online, and there were some attendance at clinics and in labs, but in a different way and in different groups. There was also another experience in which socioeconomic status was taught first by giving resources through WhatsApp and then attending, and that also saved time. One of the ideas for recommendation from the student was that after giving the online sort of lectures, when they come on clinic or on lab, it would be useful if you would reiterate some of what was said before just jumping into it. So that's pretty much what we had in our group. Thank you.
Thank you very much. I will now move on to group 3, which was from Alhadi, Nanditha, Rasna, Yaka, Sorelle, Shiba, Thomas, and Vinodini, who would like to report back.
Sir, if you permit, I will do that. To the answer to the first question, the situation we started doing the blended learning was during the time of pandemic. Before, it used to be always a traditional face-to-face teaching. So it was kind of like very unprepared, and it was an emergency remote teaching what we did. But the advantages was that because it was a backward design, the material, videos, everything was shared with the students before. So they used to, and even the lectures used to be uploaded in the learning platform. They used to come prepared and come to the class. So when the face-to-face sessions, which happened once a week, it always used to be like small group discussions and active methods of learning, where the questions like application and analysis of the topics were discussed. So that way, I think in the Bloom's taxonomy, initial that baseline things the students have finished at home, and we were doing the higher points like analysis and application. So that way it helped, and in a way that has given the responsibility, the ownership of learning to the students, which made them, I think, mostly like self-regulated learning, and I think definitely it will lead on to the lifelong learning. Second thing is that what led to the success of this blended learning, because for all of us, the faculty, it was something new. So the faculty development program, which was offered by our president, was excellent. All of us were taught by the IT department about the learning platforms and teaching and all that. And at the same time, student support was extended by the IT people as well as by the faculty. I think that contributed to a very great extent to the success of this blended learning. And also during the lectures, we were using polls and other methods so that student engagement was ensured. And where we go from here, take home message, I feel that blended learning has come to stay. Even post-COVID, I think definitely we all will be doing at least 50% of our teaching learning through this blended method because it is very useful for the students, because the materials are uploaded before. They can read and study at any time they want, when they feel like reading, and at any place they can do it, and they come prepared. They have the ownership of their own learning. So I feel definitely post-COVID also blended learning is going to stay, sir. Thank you, sir. Thank you.
Thank you very much.
Thank you.
And then we have our last group before we turn it back over to Thomas Chaco. The last group was Rashimi, Wasim, Farah, Flo, John, Lorraine, and Nicholas. Who would like to report back?
Hello, sir.
Go ahead.
This is Rashmi. So in our group during the breakout session, majority of us felt that the blended learning came to actually into picture during this pandemic in the last 1.5 years. But one of our participants felt that the blended learning was the best suitable for them. That was during CME or CPD session. So coming to this during pandemic, even though we had a knowledge of blended learning a bit before the pandemic, but we started exploring about it actually during this pandemic. So what was it was help for the success? What contributed the most of its success? The first thing is that the strong technical team, that's what our group felt. And second one was learner-centric approach. And even we could implement so many things compared to our normal classroom teaching. Like we gave more emphasis on small group teachings and self-directed learnings, where we thought we can concentrate on the students better. And to make sure that whether they have learned, we used to take a poll, as one of our participants already told. And also we used to make a kind of pre and post. We used to make a Google Forms, give a pre-questionnaire, and take a lecture. At the end of the lecture, we used to make sure whether the majority of them have learned. That's the post questionnaire. Those were the things. And as somebody told, even if the pandemic gets over, even our university is planning to actually go with the 50-50, 50 actual teaching and 50 the online teaching. That's how the blended learning will come into success. Thank you, sir.
Thank you, Rashmi. Back to you, Thomas.
So the breakout sessions brought out a lot of learning and experience sharing. It was a broad kind of a spectrum of experiences. Some of them were totally kind of in a stage of shock and awe, did not know what to do, and they have not tried blended learning at all. But having listened to the various ideas, they intend to take back the message and try to apply. But what some of them have identified the challenges is the network issues, and in some places, since it was sudden, it was the technologically challenged teachers. They were reluctant to engage in blended learning, and so there is a need to have a faculty development program so that they can be equipped, and the reluctance to contribute meaningfully in the blended learning is possible. Then another point that was mentioned, I think, by Rashmi, was the necessity or the need for a strong technical team to back up and make it happen. So that is a good point, and without the strong technical team backup, the faculty will find it difficult. Um, then another good practice is the use of assessment of the learning. Unless we build in the assessment of the learning into the blended learning program, the students will not take it seriously. But indirectly also we can assess their learning by asking them to submit assignments. And it need not be one of the challenges with um, grading the assignments is if they write long answers, it is difficult. So MCQs is one way of uh, assessing their learning. The other way is a one-pager summary, like concept map or some such thing, which
Reflective summary.
at a glance it is possible to verify that that they have learned. So the other key message that came through was that blended learning, having experienced the benefits of blended learning, it is here to stay. Even when the COVID goes away, we all will continue with the blended learning. The usefulness has been appreciated both by the teachers as well as the students. And even if teachers are reluctant, students will demand blended learning to be included. And so I'm sure blended learning is here to stay, and we need to adopt and adapt. Thank you.
Thank you, Thomas, for sharing your expertise and your experience. I think this has been a very rich discussion and lots of sharing from across the world. And I wanted to end with the reminding everybody that if you have a symposium or workshop that you would like to share your expertise that then engages the TUFH community, under our events tab you have the 2 links. And you can always submit your ideas for a symposium or for a workshop. Therefore, anytime you want to share their stuff, and then TUFH serves as a platform for you to share that. But with that, we are just about the hour. Any final comments from anybody before we close? And again, a great amount of thanks for Thomas Chaco for sharing your expertise and learning. I think it was very beneficial for everybody. Any final comments?
It was a wonderful session, Dr. Thomas and Dr. Nick. Wonderfully presented, wonderfully conducted. Alicia and Nick and Thomas, how are you? Ages we didn't see each other. Ages.
See you.
I'm so glad to see. Sweet memories of Coimbatore conference.
Welcome.
Well, enjoy your mornings or afternoons or evenings, and we will see you next time. Thank you so much.
Thank you, sir.
Thank you.